Hello my dear subscriber and viewers, welcome back to Akshara Akshita 2023 channel. In this video, I am going to explain about coding guidelines for colonoscopy. So you know all right, colonoscopy is a very important topic for CPC exam. So every exams they will ask one question from this guidelines. Okay, so please watch this video until end without skip, then only you will get a clear idea about colonoscopy. This is very simple technique only, but there are more concept is there in this colonoscopy. Okay guys, those who are not subscribe my channel, please subscribe my channel, press bell button, select all, then only you will get my all future videos as notification. Okay, let's start from first topic is actually every scopy you have to know the definition. So if colonoscopy means from which to from and up to where the scopy to reach, so that definition you should know. Like that, colonoscopy definition is to examination entire colon from rectum to cecum is colonoscopy. Okay, so this is the definition. Okay, then the code range is based on the approach. First you should know the approach. So this colonoscopy through stoma or colonoscopy through anus. So you should know before starting the CPT code range. Please check the approach thoroughly, whether this colonoscopy through the stoma or through the anus. If it is colonoscopy through stoma, means code range from 44388 to 44408. This is colonoscopy through stoma. Okay, stoma means colonoscopy through stoma, examination of colon from colostomy stoma to cecum or small intestine anastomosis. So and may include examination of terminal ileum, small intestine proximal to anastomosis, patient who has undergone segmental resection of colon, that means hemicolectomy, sigmoid colectomy, low anterior resectomy, has this patient all has a colostomy. So through this colostomy, if colonoscopy is passing, means this is the code range. Okay, 44388 to 44408. Okay, if colonoscopy through natural orifice, that means anus. Through anus to rectum means code range from 45378 to 45398. Okay, so first you should know whether colonoscopy through which approach, either it is stoma or it is natural orifice. This is the first step. Okay, next, then types of the colon, types of the procedures. What are the types of the procedures are there from colonoscopy? Whether patient came for screening or diagnostic or therapeutic or surveillance. So you should know for what reason patient is coming, either it is screening colonoscopy or diagnostic colonoscopy or therapeutic colonoscopy or surveillance. So the first definition is screening colonoscopy. What is the screening colonoscopy? When we can consider it as a screening colonoscopy? So screening colonoscopy means provide to patient in the absence of signs and symptoms based on the patient age, gender, medical history and family history. According to this, patient may came for the medical screening for the colonoscopy. Okay, so it is definition by population on which test is performed, not result or findings of the test. Like in such cases, the patient came for routinely, whether asymptomatic patient may came routinely for the screening. Age wise patient may come. So particular to this age, colon polyp will be there. So doctor may suggest you can do this screening colonoscopy. So patient based on the patient age or medical history or family history. So for these reasons patient may come, but patient doesn't have any signs and symptoms. Nothing will be there for patient. Just for screening, if patient is coming, means we have to consider this patient is screening colonoscopy. So screening code only we have to give. Okay. Next, diagnostic colonoscopy means diagnostic. You know, right? This word is diagnostics. What is the condition? To identify that condition, patient is coming for the colonoscopy. Okay, so patient already has any symptoms like rectal bleeding, rectal pain, or pain in the testes. Like the patient has any symptoms, any signs and symptoms, patient coming to diagnostic the condition means that is a diagnostic colonoscopy. Okay. Next, therapeutic colonoscopy means patient already knows what is the condition. So now patient came for to treat that condition, that is a therapeutic colonoscopy. Next, surveillance means surveillance colonoscopy when patient is asymptomatic but has personal history of gastrointestinal disease or colon polyp or any cancer, any rectal cancer. So this patient we have to consider is surveillance colonoscopy. Okay, now we know the types of the colonoscopy and their definition. Now what are the guidelines are there? First we'll check one by one. So guidelines for screening colonoscopy. So what are the guidelines? If it is patient came for if we identified patient came for the screening purpose. Screening purpose means nothing have any signs and absence of signs and symptoms based on the history or age patient is coming. That is screening colonoscopy. Patient came for the screening colonoscopy. First we need to check patient's insurance. Patient's insurance, either it is Medicare patient or non-Medicare patient. If it is non-Medicare patient means the screening code will be 45378. If it is Medicare patient means we need to code HIPIX code, level 2 code only. There are two codes for screening colonoscopy for Medicare patient, that are G0105, G0121. These two codes is for Medicare patient screening colonoscopy. If it is Medicare patient means there are two codes G0105, G0121. These two codes are there for screening colonoscopy for Medicare patient. If it is non-Medicare patient means 45378. Only one code. Diagnostic colonoscopy only we have to code it. Okay. Next, patient came for screening but it is converted to diagnostic or therapeutic means from 45378 to 45398. From this range we have to code one code, then PT modifier we should append. Okay, PT modifier for screening colonoscopy converted to diagnostic test or therapeutic procedure. So for this reason we have to append PT modifier. Okay, this is the guidelines for screening colonoscopy. So now you understand, right? Screening colonoscopy means we need to check. First step is patient's insurance. If non-Medicare patient means 45378 code. If Medicare patient means two code, 0105, G0121. These are two codes. So let's see what are the two codes when we have to use between this code. So G0105 is high risk patient, G0121 is low risk patient. When we can consider high risk, low risk? Let's see. So if it is patient is high risk means patient have any adenomatous polyp, colorectal cancer, inflammatory bowel disease, including Crohn's disease or ulcerative colitis. So patient has any personal history of these conditions, then that patient we have to consider as high risk patient. This is personal history. If patient's family history or adenomatous polyp or colorectal cancer means colorectal cancer direct relative only, close relative like siblings, parent, child. So for this patient we need to consider that patient as high risk. Any one reason we can consider as high risk, either to personal history or family history. So if we don't have this information, then that patients will be low risk patient only. Okay. Now we know a CPT we are coded. For ICD, what we have to code for screening colonoscopy? For screening colonoscopy, we have to code always primary code Z12 code only as a primary ICD code. Okay. Then secondary, what is the condition doctor identified, either polyp or whatever it may be, that will be as a secondary diagnosis. Then family history, any personal history means that Z scores we can bill finally. Okay. This is about screening colonoscopy. Let's see diagnostic colonoscopy coding guidelines. So diagnostic colonoscopy means so if patients has any signs and symptoms, patient is coming to identify what is the reason for that symptoms. So to identify that condition, patient may come for diagnostic colonoscopy. So there is only one code 45378 if it is approach is annus means. Okay. Then if coding, then next coding guidelines for therapeutic colonoscopy. Let's see, there is on decision tree making. Let me explain about that. So this tree we have in book also. Okay. So if patient coming for diagnostic colonoscopy, that colonoscopy is not reaching the splenic flexure. So before splenic flexure, colonoscopy procedure stopped. That time we have to code 45330 flexible sigmoidoscopy only we have to code it. Okay, this is one point. Next point is that colonoscopy reached splenic flexure, and beyond splenic flexure colonoscopy reached, but does not reach up to the cecum level means. Then 45378 colonoscopy, diagnostic colonoscopy we have to code with 53 modifier. 53 modifier is discontinuous procedure. That modifier we have to append if colonoscopy beyond the splenic flexure but not reached to the cecum. That time we have to append 53 modifier. Okay. Then if colonoscopy without any difficulty from anus to cecum colonoscopy passed means normal colonoscopy diagnostic code we have to code without any modifier. Okay, this is diagnostic procedure. For therapeutic procedure, same sigmoidoscopy, if colonoscopy not reached splenic flexure means sigmoidoscopy therapeutic code only we have to code. The code range from 45331 to 45347. If the colonoscopy beyond the splenic flexure but not to the cecum means same colonoscopy therapeutic code. The code range from 45379 to 45398 CPT code with 52 modifier. If diagnostic purpose means 53 modifier. If therapeutic purpose means 52 modifier. Okay. For therapeutic purpose, if colonoscopy without difficulty it reached up to cecum means we have to code any one procedure from therapeutic code range without any modifier. Like code range from 45379, 45398 without any modifier. Okay, this is about decision tree making. Okay, then if coding guidelines are for this procedure, already I explained you in last video. So whenever bleeding occurs as a result of this procedure, so to control that control bleeding procedure doctor is performing means we should not bill with this main procedure. Control of bleeding CPT code, that will be integral part of the main procedures. We should not report. Okay. This is the guidelines. Then then therapeutic colonoscopy, we have polyp removal therapeutic means any treatment, right? What if doctor identify the condition, doctor is treating towards that condition, against that condition, that is the therapeutic. So therapeutic means polyp removal. So that polypectomy means we have uh, three technique. Okay, types of the polypectomy technique. There are three types. One is hot technique, another one is snare technique, then cold biopsy technique. Hot techniques means 45384. Snare technique means 45385. Cold biopsy technique code is 45380. So based on this technique, based on the technique, we have to finalize the CPT code. Okay, let's see the coding guidelines for polypectomy. The first point is, if single polyp with different technique means may be reported only one extensive technique. Okay, for example, sigmoid polyp is there in the sigmoid colon. Doctor is performing removing that polyp from the sigmoid by hot technique as well as snare technique. So only one polyp from the sigmoid polyp only doctor is removing by two technique. That means only extensive technique only we have to code. We should not code two technique for single polyp. Okay. So hot technique, snare technique, which one is more extensive procedure means snare technique only more extensive procedure. For exam purpose, I can tell you what are the techniques are more extensive. For job, when you are doing job, you can yourself itself you can identify which technique is more extensive procedure, because when we enter the CPT code after that dollar value will be there. So for each CPT this is the dollar value, for this technique this is the dollar. Based on that amount we can identify the more extensive procedure. For exam purpose you can remember what I am telling. So snare technique is the more extensive procedure, so hot technique is less extensive procedure. For single polyp, more than one technique if doctor is performing in means only more extensive technique we have to code, that is snare technique 45385 only we have to code it. For multiple polyp removed with a different technique code means all technique we have to build separately with 59 or XX modifier. Okay. So for example, polyp is there in the sigmoid colon. Then ascending colon also polyp is there. Doctor is removing polyp from sigmoid colon by snare technique. Then ascending colon polyp doctor is removing by hot technique. This time we have to build both technique together with 59 modifier, but sequencing will be more extensive technique as a primary procedure, less extensive technique as a secondary procedure with 59 or XX modifier. This is the guidelines for polypectomy. So this is the sequencing. Snare is a more extensive. After that hot technique is less extensive. The finally cold biopsy is very less extensive procedure. Okay. From see this diagram, centimeter wise they have mentions. So this also I will explain you. So for sometime doctor will not tell which colon polyp is there. So, sometimes, no, rarely only, not all the time. So most of the time doctor will mention polyp in the ascending colon, polyp in the transfer colon. But sometimes doctor may use centimeter. So polyp is there in colon 20 centimeter. Polyp is there in colon 50 centimeter. So means this 50 centimeter means which colon we don't know, right? So we should know from which centimeter to which centimeter which colon. So we should know this diagram. If it is rectosigmoid means 15 to 17 centimeter means rectosigmoid. 17 to 57 centimeter means sigmoid. 57 to 82 centimeter means descending colon. 82 to 132 centimeter means transverse colon. Like this, by seeing the centimeter, we have to know which colon. For example, 60 centimeter colon polyp is there. Doctor is removing by snare technique. Means which colon ICD you will give? 60 centimeter comes under 57 to 82 centimeter. So that is descending colon. So we have to code descending colon as a ICD code. Okay. Like that, by centimeter wise also we have to identify the which type of the colon. Okay. So that's all about the colonoscopy coding guidelines. I hope you all understand. If you have any doubt, please comment. If you don't have any doubt also, please comment. If you like this video, please comment like super good, very good, like that you comment. If you don't like also, you comment, no, I don't like this, I am not understanding. If you feel like that also, you can comment. If you like this video, please like it. Why I am telling means, if I am getting more comments, more likes means my video will reach to many peoples. For that reason only I am telling each video, please comment, like that. Okay. So if you like my video, please share to your friends also. Don't forget to subscribe my channel. Let's see next video. All my minor endoscopies like EGD, then ERCP, like that major scopies I am going to cover in next video. So please follow my channel and don't forget to click like button. Okay. Thank you guys. Thank you for watching my video. Bye bye.